Hello, friends. Today we're going to discuss about digital mental health. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences. In this video, I'll be discussing about digital mental health, whether the digital mental health is effective or not, whether the intervention used is helpful or harmful to the public will be discussed, what are the opportunities and challenges with regard to digital mental health, the legal framework across digital mental health will be discussed, and what is the future of digital mental health. Digital mental health is growing very rapidly. The health applications are proliferating like anything, my dear friends. Approximately 4 to 5 lakhs applications are available in the market. There is a huge market with regard to health applications. It is expected to grow from $49 billion to $105 billion within a span of next 7 years. And it is expected to grow at 11.6%, that is compounded annual growth rate, my dear friends. It is basically pushed because of managing of chronic mental illness, chronic other illnesses such as diabetes, hypertension requires constant monitoring and treatment, my dear friends. Not only that, the growing elderly population who require treatment at home or in the community. At the same time, the youngsters who are tech savvy millennials are adopting health applications very fast. Hence, my dear friends, the future for digital mental health is very bright. If you look at the definition of digital mental health, it refers to the use of information and communication technology in medicine and other allied health professions to manage mental illness, mental distress, health risks, and to promote wellness, my dear friends. Digital mental health has a broad scope and includes the use of wearable devices, mobile health, big data, genomics, e health, health information technology, and telemedicine. Digital mental health is also associated either a wearable devices or without a device. The wearable devices are such as smartphones along with watches, that is sensors which is going to collect data. And many a time it may not have any device, just a mobile phone may be also considered. As per the World Health Organization, my dear friend, WHO Assembly resolution passed on 26 May 2018 has demonstrated a collective recognition of the value of digital technology to contribute to the advancing universal health coverage and other health aim of sustainable developmental goals. That means both the policymakers, the industry, public at large have recognized the industry's need in the area of chronic illnesses and mental health. That means it is a fertile soil for the growth of digital mental health, my dear friends. Now let's understand about the digital mental health intervention and its and effectiveness. Whether these digital mental health applications are they effective? Let's understand about this. Digital mental health intervention such as applied gaming, internet cognitive behavioral therapy, virtual reality, augmented reality, mobile applications, online therapy, telepsychiatry, teleconsultation, and so forth have been found to be helpful in the preliminary studies. But one need to understand about the limitation. Limitations such as early dropouts, lack of engagement because there is no human touch with regard to digital mental health, lack of personalized care, and also cultural adaptation is a big challenge. If you look at the digital mental health application and these health application or any other applications, if you look at the engagement within first 48 hours, 80% of them do not use and they completely get dropped out and finally it will be deleted. Over a period of 10 days, only 10% of them will be using any application. That means, although you know you have the data within first 10 days, so many applications have been downloaded. Unfortunately, 80 to 90% will not be used in the first 10 days, and even in the long run, there will be dropout. And this has been found to be across all the application, including health app and digital mental health app. So, why is this so? How can we improve on this? There are various studies have been done comparing by using exclusive digital mental health application versus if you are giving a human support with digital applications. That means if a person or a patient is using a digital application, you need to support him by a person who will be calling them and asking whether they are using the application. Are they facing any difficulties? How the healthcare provider can help him in using this application. That means by adding a human service provider, it can be a non clinician, it can be a clinician, it can be a counselor, nurse, paraclinical, peer, parent, and these people, if they are coupled with the digital application, then the outcome will increase phenomenally. This is various studies have shown. Now let's understand an important study which was done with regard to engaging children and young people. As you know, children is below 18 years, young people that is up to the age of 24 years, and some studies have considered even up to the age of 28 years. In this study done by Liverpool and his colleagues in 2022, with regard to the title of the study is Engaging Children and Young People in Digital Mental Health Intervention, systematic review of modes of delivery, facilitators, and barriers. This is the study. Let's look into the study. In this study, they included 83 reviews. That means an important, that means 83 studies were included. If you look at the various types of intervention, first one is internet based intervention, computer or laptop based intervention, mobile apps based interventions, digital device or wearable device or robot based intervention, virtual reality, and mobile text based intervention. So there are six different types of interventions have been used, and sometimes combination of these also have been used. What did this systematic review said? After reviewing the 83 studies with regard to delivery of these digital mental health with regard to engaging children and young people, this study clearly said that children and young people prefer to use digital health intervention such as videos, texts, ability to personalize, ability to connect with others, option to receive text messages. The findings of this review suggested a high average retention of 79%. Studies have shown clearly. And this is in youngsters, my dear friends. And what are those factors which play a crucial role in retention of young and children? You look at the diagram, you'll be able to understand this. First, at the top, you'll be seeing intervention specific influencing factors, and the bottom, you'll be seeing person specific influencing factor. If you look at the top one, it is the intervention based, that is, whether it is this, whether it is outcome is good, whether it is acceptable intervention, usability with regard to digital, suitability, cultural adaptation. So, all these will become a very important with regard to intervention specific digital intervention. If you look at the bottom, that is the person specific. What is the motivation of the person? Opportunity, trust and anonymity, capability, whether he has a stress, and one need to understand all these digital mental health intervention is available anytime, anywhere, any place, without human bias and unconditional acceptance by these applications or chatbots. Think about it. In a therapy, or else a person who is providing intervention has its own positive and also negative. The positive are many, the negative may be biases, and also with regard to availability, and it will be healthcare provider centered approach. Whereas in digital health, it is consumer or client based. That means consumer based or consumer centric services. Here, the consumer will decide when he will have the services at any place, anywhere, anytime, any number of sessions with using those applications. And these applications can be individually, completely AI based and based upon the both the individual specific factors and intervention specific factors, the children and youth will adapt and also accept this. Similarly, there has been one more important study done by Letmaki et al., that is, like Letmaki and his colleagues. The title of the study was Evidence on Digital Mental Health Intervention for Adolescents and Young People. A systematic overview was done. In this study, again, they included the 18 studies and there were no meta analysis. These were not just 18 studies, these are 18 reviews. This results of the study clearly indicated 18 systematic reviews were included. They found evidence on the effectiveness of computerized cognitive behavioral therapy with regard to anxiety and depression, whereas the effectiveness of digital mental health intervention with regard to other illness is not conclusive. Here, one need to understand the depression and anxiety is present ubiquitously and they are at the 10 to 15%. That means by using digital mental health, you can decrease the number of persons suffering from anxiety and depression. That's what this 18 systematic review was done. Intervention with regard to in-person element with the professional, that means adding a person with the digital health intervention. It can be a professional, it can be a peer or a parent where associated with a greater effectiveness. That means by just giving an application the patient will not improve. Along with an application, somebody has to handhold him through navigating by using these applications, how often he is using and how effective he is using, and also follow up with the healthcare provider increases the outcome. And there was another important study, and the title of the study was Gaming My Way to Recovery, a systematic review. This was done by Ferrari and his colleagues in 2022, and this was published in Frontiers in Digital Health. The title of the study was Gaming My Way to Recovery, a systematic scooping review of digital game intervention for young people with mental health treatment and promotion. Please understand, this was an important study. I request all the viewers to access this article, which is available freely on the internet, and they have done an amazing systematic review. This review identifies the literature with regard to video game, and this video game has been used as a therapeutic purposes for various mental illness. And this is used between the age of 12 to 29. And this review focused on the video game as an intervention for various mental illness. And if you look at this, they included 49 different studies, my dear friend, and it was a systematic review. And if you look at this, this review identified and undertook an exhaustive review of 49 studies concerned with 32 games. These 32 video games were used as a stepped care model for video game interventions for various mental illness. The authors of the study mapped the evidences on the overall aims of the game interventions, how they have implemented, evaluated, and supported through stakeholder participation, and whether using gamified intervention in youth mental health services revealed any help or not. As you look at this diagram, you'll be able to understand. As I mentioned, there were around 32 video games were involved, and these video games were divided in a stepped care model for treatment. Step 0 is for mental health promotions. Step 1 for people who are at risk. Step 2 to 3 is for mild to moderate risk people. Certain games have been used. And step 4, severe and complex mental health conditions. You can see various video games have been utilized for the purposes of treatment of various mental health conditions. What are the results? The finding supports the potential integration of digital games in youth services based on study outcomes, user satisfaction, relatively high program retention rates, and the potential usefulness of most games for mental health treatment or promotion and prevention. Most studies included stakeholders' feedback and Involvement ratings were very high for 7 games. But however, and most of the study did not include potential harm which has occurred with the users, that is, video game users. Although on one hand, we discuss, that is, video game, video gaming, that is, gaming addiction, pathological gaming you can consider. At the same time, we are using video game also for the purpose of treatment of various mental illness, especially with regard to depression and anxiety. One more important study, a systematic review of meta-analysis with regard to digital intervention alone versus hybrid intervention. Here, the hybrid intervention means providing a human support along with digital intervention. This was done by Weds and his colleagues in 2023. Recently, this article was published, that is, providing human support for the use of digital mental health intervention, a systematic meta review. Here, the results of 31 meta analysis, that is, 505 unique primary studies were analyzed. Think about that, 505 studies, and there were 31 meta analyses. The meta analysis reported 45 effect size. Almost half of them showed human support with regard to digital mental health intervention were significantly more effective than uh, standalone digital mental health intervention. That means whenever you are advising to use digital intervention, there should be a human support from the clinical team. It can be a clinician, it can be a paraclinician, it can be a technician, or else a family member or a peer or a patient who is recovered can support the person in using this digital intervention. That means human support plays a crucial along with the digital intervention, my dear friends. So, what is new here? That means by using digital mental health, you can provide an amazing intervention, and a person who is providing support may not be trained at all with regard to mental health intervention. If he knows how to support a person, that how to use this digital intervention is more than enough. So, my dear friends, digital mental health intervention with regard at this point of time, initial studies have clearly supported the use in patients with depression and anxiety. It is the hybrid model, that is, combination of clinician and non-clinician along with the digital mental health is going to make a lot of difference in reaching the people, adopting this technology, sustaining, and good outcome with regard to mental illness. Now, recently, in the past 2 to 3 months, ChatGPT has made a revolution. What is its impact with regard to healthcare? What is this ChatGPT? Chat, as I mentioned, as you know, chat is basically chatting, and here GPT means generative pre-trained transformer. It is an important tool which has been utilized at this point of time by various users and stakeholders. And there was an important study which was published in 2023 assessing the accuracy and reliability of AI generated medical response and evaluation of ChatGPT model. This is an important study which was published and available online. Here, 33 physicians across 17 specialties generated 284 medical questions. And these medical questions were fed to ChatGPT and questions were asked. And these questions were marked on two important dimensions. One was on accuracy, another one on completeness. Accuracy was measured on Likert scale from 1 to 6. One was completely inaccurate or incorrect. 6 was completely correct. And my dear friends, ChatGPT scored median of 5.5 and mean average is around 4.8, my dear friends. Think about this. Out of 6, 5.5 median and 4.8. That means it was almost accurate, my dear friends. With regard to completeness, it was measured on 3 Likert scale. One is incomplete and 3 is completely complete with regard to answer. ChatGPT scored median of 3 and mean of 2.5 with regard to completeness of answer, my dear friends. And ChatGPT is able to provide information to the patient and also to the clinician. That means it can be used in medical colleges and medical universities. Another important study, which was published by How Does ChatGPT Perform on US Medical Licensing Examination? The implications of large language models for medical education and knowledge assessment. This was done by Gilson and his colleagues, published in 2023. Here, the author used two sets of multiple choice questions to evaluate ChatGPT's performance. The first set of questions was used for step 1 by AMBOS, the medical questions which are available. Step 2 for NBME, that is National Medical Examination Licensing Examination, which those questions are available. ChatGPT performed at a greater than 60% threshold on NBME free step 1 exam dataset. The model achieves the equivalent of passing score of a third year medical student, my dear friend. ChatGPT's capacity to provide logic and informational context across the majority of the answers, my dear friend. That means it not only gave an answer, it was able to give logical answers, my dear friend. These facts taken together is a compelling model for utilizing this in medical education, my dear friends. Not only that, if you are able to improvise ChatGPT from 4, maybe in 5 or 6 version, this can be utilized for patient care, and also patient can get certain answers directly from ChatGPT with regard to their illnesses, with regard to their intervention, and also ChatGPT can be used for administering informed consent, my dear friends. Now let's look into the challenges and opportunities. Now, the biggest challenge is data privacy. Here, if you look at this diagram, there is a doctor, that is a healthcare provider, and a patient. Between them, there are many people are available now, or they have become an intruder. First and the foremost is medical devices. Not only that, devices such as the router, modem, computer, mobile phone, these devices are there. These devices are collecting information, not only the patient, but also from the devices used by the doctor. As I mentioned, router and modems, internet service provider, both at the patient end and also at the healthcare provider end. Now, these data are stored in the cloud. Now, that means the cloud storage company comes into picture. Health insurance, they are accessing this data. They are also one of the important intermediaries, my dear friends. As I mentioned, medical devices, electronic health records, that company will come into picture. Medical transcription, the person who is coding the data, biomedical, pharmaceutical industry, the person who is dispensing medicine, and finally, the banks, which are paying the amount either through insurance or the patients, they themselves. Now, look at the number of people who have come between the doctor and the patient. Earlier, they were physical, and the direct contact between the patient and the doctor was not there. That means these actors are playing directly with the patient's data. Think about this. In such a complex world, how will you guarantee the data privacy? Here, you need to understand the number of actors who are involved. First and the foremost is the data creator, that is, healthcare provider who is creating the data with regard to medical information of the patient. Transmitter, it is the device and the internet service provider. Business associates, such as insurance company, banking sector, medical devices, pharmaceutical industry, subcontractors, the person who is working with these internet service provider, cloud management, or else even with the pharma industry, where the person is providing software support. So these are the n number of people who are coming in between the healthcare provider and the patient. In such a scenario, think about the data privacy. Here, the data privacy are both online security and also physical security. Online security, as you know, how will you encrypt the data when you're transmitting? Physical security, are you allowing any person to copy them either on the DVD, CD, or else on a USB device? That means who is having access to these devices, to this internet, or through the LAN port? Many a time, people may even access through the LAN or maybe internet by hacking. So, although the digital mental health comes with a amazing opportunity, the challenge with regard to data privacy is a big challenge, my dear friends. Now let's understand about the health. Health is highly regulated, my dear friends. As you know, the Consumer Protection Act comes into picture. There are at least 52 regulations are there whenever you want to start an hospital. That means you need to take license, regulations, permissions, and also you need to register with various laws. That means health is highly regulated not only in India, across the world, but applications, softwares are minimally regulated when compared to health. Think about this. Hence, the technology is growing very fast because there is no regulation or speed breakers, whereas health has many speed breakers, such as you cannot do research with the patient, you need to take consent from the patient, you need to take permission from the government, you need to take permission from the ethics committee, institutional review boards, whereas the new applications are coded every minute by every person who is a software engineer, and it is released into the cloud. Whereas health is highly regulated. Now, you need to marry this both health service and digital applications. One is regulated, highly regulated, or over regulated. Another one is under regulated or minimally regulated. That is the challenge, my dear friends. So, the important thing you need to understand is security, privacy, and confidentiality is a big question with regard to digital mental health, and also digital literacy in rural area is a big question. High dropout and poor engagement with regard to using of applications, data marketing is a big ethical challenge. Last mile connectivity is still a big question in many parts of India. Unregulated applications claiming that it produces 100% loss of weight, improves your body, maybe the musculature or personality. Such kind of unregulated and claims have been made, and there are no research has been done with regard to effectiveness of these applications. Unethical advertisements and boundary violations are occurring in the digital world with regard to health services, my dear friends. But at the same time, what are the opportunities? Opportunities like coming up with a legal framework, my dear friends. And we need to professional tagging and also the patients and also securing the database. Research on this effectiveness of this application should be done at the fast rate because you are testing an application in this year. The next year, both the hardware and the software are updated, and also they are so fast. By the time you come up with the trial result, the complete application would have been changed. Big data analysis with regard to policy making across the country is becoming a reality. And now, bedless hospital, that is community based intervention by providing wearable sensors. And nowadays, certain sensors are available which can be placed under the mattress of the patient, which will completely give the information of the patient with regard to heart rate, with regard to BP monitoring, with regard to sleep, and various other parameters can be recorded through the cloud, and the healthcare provider from any part of the world can monitor the person. And also, access to mental health care is becoming slowly a reality, my dear friends. But however, the regulation of this digital mental health application is a big challenge. Let's understand the regulations in India. All medical devices are monitored under the legal framework of Medical Device Rules 2017. These rules comes under the Drugs and Cosmetic Act of 1940, and these were released on 31st January 2017. These rules was notified under the Drugs and Cosmetic Acts, as I mentioned, my dear friends. Similarly, these digital mental health and digital intervention come under the IT Act. And now, in 2022, there was an amendment done with regard to Information Technology Amendment Rules of 2022 with regard to intermediary guidelines, and Digital Media Ethics Code was done. Health related legislations which are applicable with such as Mental Health Care Act, Right to Person with Disability Act, all these also will play parallelly, my dear friends. However, one need to understand these applications are not being monitored, not being regulated. These standalone apps are not being regulated till date, my dear friends. However, recently, FDA of US, Food and Drug Administration of US, started regulating these applications. Although these are not applicable in India, but they are regulating such as applications Endurex, which is a standalone application for treatment of ADHD, my dear friends, especially with regard to attention. Here, these Endurex has to be prescribed by the healthcare provider, and the client will download, and the healthcare provider will give the code. By using these applications under the strict monitoring of the physician, will improve the attention span, my dear friends. Similarly, nightwear is another application which was approved by FDA. This is with regard to nightmares in PTSD, my dear friends. Another important application is Reset with regard to opioid and substance use disorder. This has been found to be very helpful in RCTs, my dear friend. And Somirest is a sleep quality applications which have been approved by FDA. And these are the applications which are approved in US. But in India, there are no monitoring mechanism. Hence, there is no comprehensive legislation with regard to this digital mental health application. There are patchy rules and guidelines and case laws. Personal data protection bill still pending in the parliament, my dear friends. Hence, there is an immediate need for coming up with a legislation which is going to monitor health technology, my dear friends. However, recently medical device policy was released on April 2023 because, again, medical device industry is a huge industry, and 80% of the devices India is importing. Now, India has to come up with a policy and need to manufacture, innovate medical devices for our own population, my dear friends. Now, the question is, what is the future of digital mental health? First and the foremost, the future is very, very optimistic, and it is going to grow in leaps and miles, my dear friends. That means we need to have a legal framework at fast that will help to regulate this growing field. This industry is a multi-million dollar sector, my dear friends. Whether we like it or not, this industry is going to grow. If you're not in the game, you'll be lost. Hence, we need to participate, and also we need to contribute in the innovation and also regulate this industry. Wearable devices is going to increase, and digital phenotypes and Ayushman Bharat Aadhaar card and also health card need to be used so that every person in this country will have their own unique health record which is secured by the government of India. We need to accept the mixed model of both digital mental health and clinician providing the care. That means hybrid model is going to work. You need not think that just a digital mental health is going to cure all mental illness. Sorry, technology is not the answer for suffering of human being. The technology is going to decreases the communication gap, increases the scalability of the service provision. It is the end. The human has to use it, and the human has to advocate for the use. That means there is a need for a human in between the user and the service provider. However, transparency and accountability is going to increase. This digital mental health is going to break the stigma by breaking the myths and stereotypes. Internet is going to provide the information, and ChatGPT is going to give the state of the art information which is available, and also the latest information which the patient can access. Educating public, social media, availability of resources, service provider across the country is available at the fingertips. Further, mental health care, life skills apps, suicide prevention app, parenting skills app, wellness applications, they are going to increase. Similarly, World Health Organization is coming up with their own applications. One is the AI chatbot by Florence for mental health, and also for substance use and wellness application has been released by World Health Organization. Slowly we are going to have bedless hospitals providing care in the community at the home will be the norm over a period of time. Big data analysis and also personalized care, localized care, regional care will be the norm, my dear friend. India need not take the guidelines from US. Based upon our own data, based upon the analysis of big data from our own country, based upon the results and analysis, we can come up with their own clinical decision making, my dear friends. That means it will be real time, and the clinical decision will be based on the algorithms of our own clinical data, my dear friends. Genetics and digital technology will go hand in hand, and that will be the future, my dear friend. Services provision, such as e prescription, delivering medications at home, not only by the private and the government, will become reality. ChatGPT, metaverse, augmenting reality, virtual reality will improve the service provision, and also scalability will increase phenomenally, and exponential growth of services will be a reality. AI assisted decision making for the physician, clinician, and also healthcare service provider will be a reality, so the error will decrease. The research also will be going to augmented because of these applications, wearable devices. ChatGPT will write the available latest information, literature gap, and also it's going to analyze the results if you are able to give the results, so that the clinician and the researcher will be focusing on data collection. ChatGPT will do the rest of the work, my dear friend. It will write the manuscript also. So, to that, there will be the redundancy with regard to writing of the information. The content writer will be no longer required over a period of time. Hence, the ChatGPT will play a major role with regard to research publication, PhD publications, and also MD thesis publications, my dear friends. Here, results, discussion, and also literature review will be done by the ChatGPT, my dear friends. So that means you will be focusing on only the pure research, my dear friends. With regard to academics, ChatGPT is going to give the latest information not only for the students, physicians, and also for the service users. And students will be getting the latest digital health learning, which will be standardized not only across the country, across the globe. Every student will learn with the standard information and standard curriculum. Theory classes will be available anytime, anywhere, any place on the cloud, my dear friends. Now the students can focus on the skills rather than waiting for the theory classes. ChatGPT enabled exams. That means human as an examiner will be eliminated over a period of time because of the biases. ChatGPT will do the examiner's role and give marks to the student, my dear friends. To conclude, public mental health will be the focus. And digital intervention will play a crucial role over a period of time. Digital intervention is going to be here and it will evolve rapidly, whether we like it or not. We have to get involved in this so that we can regulate and give a scientific growth, and also what is culturally required to our country can be considered. Digital intervention free from human therapist bias, no racial discrimination, no geographical discrimination, regional discrimination, and also religious discrimination can be eliminated by this digital mental health, my dear friends, so that the user can approach these digital health intervention and consume the services provided by them. However, as I mentioned earlier, the need for human support for using this digital health is highly required. Digital mental health is a multi billion dollar industry and it is expected to grow exponentially. But looking at the past, the adoption by the healthcare providers will be very slow. Of course, there is a need, there is a huge treatment gap, but unfortunately, the healthcare providers and the users may have suspicion with regard to use of their data. Hence, there is an urgent need for robust legal framework, not only in the regional, that is national level, but also globally. We require to have a convention which is moved by the United Nations is the need of the hour at this point of time, because digital world is a global world, my dear friends. Hence, a national law may not work to the maximum extent. We need to have a global or international law which is going to regulate this digital mental health. Future of digital mental health is very bright with regard to clinical area, that is providing services. Not only that, in prevention, promotion and wellness. With regard to academics, that is training of students, healthcare providers, and also healthcare workers is also an important component. And finally, digital mental health is going to boost the research in the area. But however, there are some challenges which needs to be addressed at the earliest. Thank you very much for giving your valuable time. Stay safe.